This audio recording will provide an overview of Chapter 1, Introduction to Assessment. The learning objectives for this unit will be, by the end of this PowerPoint, students will understand the following: what is assessment, the purpose of assessment, multiple methods and multiple sources of assessment, the competencies required for assessment, and a historical perspective of assessment, assessment and technology, controversial issues in assessment. So the first question is, what is assessment? The term assessment refers to any systematic procedure for collecting information that can be used to make inferences or decisions about the characteristics of people. It is important to understand this definition, as the term assessment is often confused with the term test, and this confusion is compounded by a modern education system and even other textbooks that use the term assessment and testing interchangeably. So who uses assessment? Assessment is used by a large number of different professionals for differing purposes. These purposes largely correspond to the nature of their work and their clientele. Counsellors, for example, utilise assessment to screen clients with mental health disorders, diagnose, treat, and to evaluate outcomes of treatment plans. Career counsellors utilise assessments to identify their clients' vocational interests, skills, and aptitudes. Vocational assessments are used in career planning or for career transitions. This semester, you'll be taking the STRONG and MBTI to better understand your personality in relation to your vocational interests. Educators use assessments to determine students' educational ability or needs, determine an appropriate curriculum and or learning style, and similarly evaluate practices to determine if an intervention is working. So the nature of assessments. Methods of gathering assessment data are also varied and can include interviews, tests, and observations. Within each category, there is great variation in terms of methods used. For example, interviews can incorporate very highly structured interviews or very unstructured exchanges that may even look like a conversation. Quality assessment involves multiple methods of data collection from multiple sources. This semester, you'll have an opportunity to gather all three forms of data from the students that you will be assessing. Now that we've examined definitions of assessment, it's important to establish why we use assessments in our work. In brief, we use assessment data to gather information about our clients so we can develop appropriate treatment plans and intervention plans. As school counsellors, educational and psychological data will be equally relevant to your work. This semester, you'll learn the processes for gathering, interpreting, and synthesizing all types of data. The first purpose of data is screening. Screening is usually a brief process to assess if a client has a notable problem that requires intervention. In educational settings, students may be screened at the beginning of an academic year to determine their reading, math, or English proficiency levels. In clinical settings, brief screenings are also referred to as instruments, may be used to gather more information about a client's possible problems. These may include alcohol or drugs, depression, eating disorders, emotional stability or volatility, just to name a few. Assessment in the context of identification and diagnosis is typically more in-depth, and data is usually gathered from a cross-section of sources. Those familiar with the assessment process for special education, particularly in regarding the determination of a specific learning disability, will be aware that diagnosis is determined based on an elongated RTI process, the results of IQ, known as cognitive assessments, achievement assessments, and the reports of multiple stakeholders in addition to observational data. In clinical settings, if data from initial screening indicates a possible problem, then clinicians may follow up with a more in-depth measures to determine if the client meets DSM criteria for a particular mental health disorder. Assessment is also used for intervention planning. For example, if a child or adolescent in a clinical setting shows signs of trauma, a clinician may decide to use trauma-focused counselling methods such as EMDR. EMDR, for example, is a neuro-interactive talk therapy for treating trauma and anxiety. It stands for eye movement desensitization and reprocessing, and combines dual attention to recovery memory with back and forth eye movements or alternating sounds or vibrations. Not to be tangential, the point is data from the identification and diagnosis stage usually signifies or provides information that is useful for intervention planning. In special education, assessment from the results of cognitive assessments may reveal that a child has a low IQ. In terms of intervention planning, it would be prudent for educators to modify the instruction accordingly so the curriculum isn't above their learning level. Finally, assessment is used for progress and outcome evaluation, also referred to program evaluation. Assessments are typically administered to help professionals determine if a treatment plan or educational plan is working or not. You're probably now getting the sense that assessment is a complex and ongoing process. As mentioned, assessment data can be gathered from multiple sources. A key skill that you will develop over time is the ability to understand how these disparate threads of data interlock and can help explain what's going on with a child. In essence, there are three types of assessments that generate different types of data. Tests are instruments designed to measure specific attributes of an individual, such as knowledge or skill level, intellectual functioning, aptitude, interests or preferences, values, personality traits, psychological symptoms, level of functioning, and so on. Counsellors may use data collected from formal and informal tests, checklists, questionnaires, inventories for several purposes, such as screening for emotional, behavioural, or learning problems, classifying or diagnosing certain attributes or disorders, selecting or placing individuals into training, educational or vocational programs or employment opportunities, assisting in planning educational or psychological interventions, or evaluating the effectiveness of a specific intervention or educational program. Test results are particularly useful in assessment because they may reveal diagnostic information that would have been otherwise uncovered without assessment. Interviews are considered the cornerstone of assessment and are employed in almost all clinical work. Interviews provide counsellor with an opportunity to hear what's going on from their perspective. Clients, however, are hesitant to often open up at the beginning of a relationship when the interview is conducted. So it's really important for counsellors to conduct interviews in a manner that conveys support and understanding versus an interrogation. This is particularly important if a client's screening data indicates the presence of a mental health disorder, yet the client is not forthcoming or doesn't open up about having symptomology in the interview. The third method of assessment is observation. Observation is an assessment method that involves watching and recording the behaviour of an individual in a particular environment. It is a way of seeing what a person actually does rather than relying on another person's perspective. Observation is useful for collecting information about an individual's emotional responses, social interactions, motor skills, job performance, and identifying specific patterns of behaviour. As a school counsellor, I was often called upon to conduct observations for children struggling with learning or other adjustment problems. An observer can often notice subtle dynamics that are influencing a child's behaviour that have gone unnoticed by the teacher, given that they have a classroom full of children. During one recent observation of a first grade child I had been asked to observe due to learning problems, I noticed that he got highly distractible during choral reading time. Unfortunately, this was one of the main instructional strategies and it simply wasn't working for that child. I was able to report back my observations in a very detailed manner, and that information was used for educational planning. So now let's look at sources of information. We know that human beings cannot be understood by the results of assessment data conducted by a single individual. Not only are tests fraught with bias, clients behave differently with different individuals across different settings. The third grader who is a nightmare in class of his math teacher may act like an angel with his or her coach. To get a 360 perspective, it is imperative to interview multiple stakeholders, or known as collateral sources. In regard to the acting out third grader, if we based our assessment report solely on information gathered from his frustrated teacher, how would that discolour knowledge of this child and viable intervention plans? So thinking about sources of information, there's 3 important sources of information: the client, collateral sources, which can include those very close to the clients, for example, parents, spouses, or perhaps grandparents. Finally, the 3rd source is professional sources, which includes teachers, physicians, mental health professionals. Perhaps in a school setting, it could be teaching assistants. If the child works with a speech therapist, an occupational therapist, they can all provide useful information in the assessment process. So this slide really just is a useful diagram of the different sources of data gathering and the individuals where you can gather that data from. So it illustrates the 3 methods: interviews, tests, and observations, and then multiple sources where you can gather that data. So for example, in regard to interviews, you may interview the client, you may interview, but you also may interview the collateral sources, professional sources, and then also review school records. The next slide looks at the assessment process. The first step in the assessment process is identifying the presenting problem. That is, the reason the individual is being assessed. Because assessment is so clearly linked to counselling, the reason for assessment and the reason for counselling are often one and the same. Reasons for assessment and/or counselling can stem from a variety of problems or concerns, such as academic or vocational performance, cognitive abilities, behavioural problems, or emotional and social functioning. Clients may be self-referred for assessment, or they may be referred by another source. In the case of children, they are always referred from another source, such as a family member, teacher, etc. Referral sources can help clarify the nature and severity of the child's problem, and counsellors should ask specific questions in order to elicit more information about the nature of the problem. The following are examples of referral questions that can help define the client's problem. Does this student have a learning disability? If so, when or if did he or she qualify for special education or related services? Is this child really ready to begin kindergarten? Does this child's problematic behaviour indicate a diagnosis of attention deficit or hyperactivity disorder? Is the individual suicidal? The second step of the evaluation process is selecting and implementing methods of assessment. After counsellors determine the nature of the problem that needs to be appraised in the assessment process, the next step involves selecting and implementing methods for collecting data, which may include interviews, tests, and observations, and determining sources of assessment information. Counsellors can choose from among numerous formal and informal assessment instruments and strategies. The final step in the assessment process is evaluating the assessment information. This is perhaps the most difficult step, because at this point, a counsellor or school counsellor will have generated information from multiple sources, and pulling it all together can be quite dizzying, so to speak. To help organise this process, Campos and Frick suggest the following method. Number 1, document any significant findings that clearly identify problem areas. 2, identify convergent findings across methods and sources. So if you're seeing a pattern of data across perhaps an interview, what you've observed, and also from test data, you would highlight that. Identify and explain any discrepancies in the information across methods and sources. So, for example, in regard to the child who's acting out in math class, you would illuminate that they do really, really well in athletics or PE, but behave atrociously in their math class. So clearly, that type of information indicates that the child can behave, but something is triggering him or her in regard to math. Number 4, arrive at a tentative formulation or hypothesis hypothesis of the individual's problem. Number 6, determine the information to include in the assessment report. As I say, you'll always have more data than will be necessary, and basically you're going to select information that really speaks to what you theorize is a child's problem, and you'll bring in data to support that theory. In the final step, you report assessment results and make recommendations. This involves describing the individual being assessed and his or her situation, reporting general hypotheses about the individual, supporting those hypotheses with assessment information, and proposing recommendations related to the original reason for referral. Qualifications to use tests. Assessments can inform high-stakes decisions about a client's educational or clinical treatment plan. Thus, it is important that professionals understand the purpose of the test, the characteristics of the specific tests, including issues of validity, reliability, and scoring and interpretation, settings and conditions of use, and the roles of test selectors. Because tests can involve complex administration, Because tests can involve complex administration, in addition to yielding sensitive data, there are many restrictions associated with test administration. Determinations of who can administer assessments to whom are usually made by test producers and state licensure standards. For example, in Texas, I was a licensed educational diagnostician who could assess students for eligibility for special education using cognitive batteries. In Tennessee, where I worked as a counselor educator, only psychologists could assess students for eligibility for special education using cognitive batteries. So while state licensure rules are sometimes unfairly influenced by lobbyists from competing professions, for example, social workers versus psychologists and counsellors, the point is tests are regulated mainly to protect the client from ill-trained professionals using information in a manner that may be harmful. The Association of Assessment and Counselling, now the Association for Assessment Research and Counselling, published Responsibilities of Users of Standardized Tests, which describes the qualifications that professionals must have in order to provide valuable, ethical, and effective assessment services to the public. So, as mentioned, the qualifications to use standardized tests depends on at least 4 factors. The purpose of the test, so there must be a clear purpose for administering the test. The characteristics of the test, so the test administrator should understand that this is a valid and reliable measure. The settings and conditions for use, so counsellors should be trained to understand not only how to administer the test, but optimum conditions where the client is most likely to do better. And then finally, the roles of test selectors, administrators, scorers, interpreters. So counsellors should be aware of the educated training and experience needed to administer a particular test. Administer and interpret a particular test, I should say. So the next several slides review the historical context in which assessment emerged. And although assessment grew exponentially in the 20th century, and often grew in response to the exigencies of war and social conditions, assessment is not new. So please take some time to read the book, the PowerPoint, and watch the YouTube video to trace the history of assessment. And there will be a discussion board question related to the history of assessment. I'm going to skip now to slide 26. So the ascent of computers and the internet have revolutionized methodology of test taking and scoring. In fact, most high-stake educational tests that are now available to take via the computer. For example, the ACT, GRE, CPCE, state licensure exams, to name a few, are all available via computer-based assessment. In the past, test takers would have had to take a pen and pencil version of the test and wait several weeks often to receive the results. The internet is also changing the current landscape of assessment. In particular, there's absolute profusion of assessment instruments which are freely available on the web. And as I say, while they're free, they are often of questionable quality, and so counsellors should be very careful in ever using a web-based assessment unless its reliability and validity is also concurrently reported. Another problem that the availability of internet assessments produces is that clients often get a hold of them and tend to self-diagnose. So we also have to be aware of that issue too, and be able to kind of talk them down off a ledge of why they don't have ADHD or why they don't have a depression. And so it's kind of complicated the world of assessment, so to speak. So now let's look at controversies in assessment. This semester we will be exploring the limitations and controversies of assessment in depth. One of the main concerns is that testing is an invasion of privacy. This is why informed consent process should always accompany test administration. With minors, a simple assent process should be provided, and we'll talk about that more as you embark on your test administrations at your school sites. Another problem is there's too much reliance on test scores for decision making without consideration for an individual's background and history. As a special education teacher and a school counsellor, I was horrified that a child could visit 3 different mental health professionals and literally pick up 3 different diagnoses. It seemed like mental health professionals were not considering this full spectrum of a child's background when they were making those determinations. The third problem is tests are biased, and they are unfair and discriminated against diverse groups. So if tests were an objective measure of ability, aptitude and achievement, why do middle-class Caucasians outperform disadvantaged groups? Tests may be self-incriminating, and individuals might have the right to rebuttal. So what does that mean? People can get labelled as a result of assessment, and this at times can be damaging. In the schools, we have to be aware not only the damaging effect of labels, but also the self-fulfilling prophecy that can accompany the receipt of a diagnosis. For example, a common refrain that I would hear in schools is, "I have LD, I'm stupid." So other controversies in assessment. Intelligent tests are not measuring the right construct. We'll be looking more at IQ tests later on in this semester. What this bullet is referring to is minorities score on average below Caucasians on measures of IQ. And many have argued that IQ tests do not measure the correct constructs. For example, the vocabulary subtest is seen as favouring middle-class Caucasians who have access to a privileged education system. Another problem is our performance on a single assessment does not really capture our full range of abilities. Unfortunately, in the modern education system, students' performance on tests drives absolutely everything, which creates too much pressure for students, teachers and administrators, and in many respects has taken the joy out of learning in this current day and age.